Now that we are done with all of our assessments, it's important for us to understand what your periodontal status is. So your periodontal status is a periodontitis patient. What does that mean for you? It means that we need to make sure that we preserve what you have currently and we don't let the disease progress any further, causing more damage. So how do we understand our patient's periodontitis disease progression and severity? We use something called a staging and grading chart. The staging part is for the severity, and that is what we have lost so far. And then we have the grading part, which is going to decipher how fast the disease is progressing. How fast is that bone loss going to be lost over time? So in order to understand how and where you are categorized with your periodontitis, we need to take our assessments and see how that is factored in. Clinical attachment loss is one of the factors that we look at for staging. So when we look at our clinical attachment loss on your maxillary arch, which is your top arch right here, you had generalized clinical attachment loss. The numbers were 4 to 5 millimeters, but the highest was one reading at 6 millimeters. And because we always take the highest number and put that as our definitive marker, we're going to take our clinical attachment loss number and we're going to follow where that number is going to lead us. So we said 6 millimeters, so that's going to either put you at a stage 3 or 4. There are other factors that are definitely going to define what stage you're at, such as missing teeth. You are missing teeth. You're missing an upper left, a upper right, and a lower left. Those 3 teeth that you're missing are also factors that can put you in a certain staging bracket. So if we look here for missing teeth, tooth loss, and we go here, we are definitely still in a stage 3 category because we are only missing 3 teeth. If we were missing more than 4, it would have jumped us to a stage 4, but we are still a stage 3. Another thing that I noted when we were doing our assessments is that you did have furcation involvements. So furcation involvement, I'm going to show you what that is. That is because of bone loss, and as the bone starts to drop and recede down, so does the gum tissue. It kind of follows with it. And as it follows with it on a multi-rooted tooth, you start to reveal an area on the tooth called furcation, which is where the 2 roots start to split. And when that occurs, that is going to then tell the hygienist or your clinician that there is indeed some bone loss occurring. This is something that we can feel clinically with an instrument, even without a radiograph. So because we see this on you, and it is something that is part of our staging, we're going to put you still in a stage 3. Now we are going to talk about the grading part, which is going to tell us how fast this disease is going to cause havoc. And of course we want to stop that, but let's understand where you are put. So we take our percentage of radiographic bone loss. You had generalized 40 to 45%, and we're going to divide that by your age. When we divide those 2 numbers together, we get a number 0.67 around. And when we have that number, we're going to see where you fall. So you falling, it says 0.67. This is the range 0.25 to 1.0%. This is the range that you are in, so you are a grade B. You are no longer a smoker, but you were once a smoker, you told me. And because you were once a smoker, I have to think that maybe this kind of contributed to your periodontal problems. I want you to continue on that journey of having no smoke in your life and being smokeless. And I want you to continue on being so diligent with brushing twice a day. However, I want to change your bristle toothbrush. I think medium is too harsh for you, especially with how you're brushing. We need to change that. We need to do nice soft circular motions with the bristles angulated towards the gum line, but we don't want to do horizontal or vertical because you already have fractions and abrasions, and that's going to cause more problems for you down the road. So let's stay away from that kind of movement and that hard of bristles, and let's do soft circular motions with a soft bristle that you're going to get in your home care kit. You're also going to use the tip of the toothbrush because I know you had concerns about the buildup in the back, and you're going to do nice vertical motions like that, and that's going to help control any of the buildup that's occurring. So I think with you implementing this and you coming in every 3 months instead of every 6 months, this is going to help us control your periodontal disease and help us maintain what you have. And this is very important, and I think together we can make this happen.